Yes,
So,
Vasu.
good afternoon, everyone, and welcome to an exclusive webinar organized by DY Patil, deemed to be university, as an initiative of facilitating exclusive interaction with industry experts.
Good afternoon.
Good afternoon.
My name is
Ma'am, today's session is on medical tourism, Ayurveda. The ancient Indian medical system, also known as Ayurveda, is based on ancient writings that rely on natural to physical approach and also holistic approach to physical and mental health. We have with us Dr. Tripti Srivastava, Ayurvedic doctor, Charak Sanjeevani Medical Tourism Private Limited.
Good afternoon, respected seniors, my dear friends, colleagues. Um, my name is Dr. Tripti Srivastava, and I'm an Ayurvedic doctor by profession. I have also completed my master's in health and hospital administration. I'm working for Charak Sanjeevani Private Limited, which is an Ayurvedic medical tourism center at Seawoods, New Bombay. Today, my topic is medical tourism. So I will be discussing many points, important points about medical tourism. Uh, Firstly, I would like to tell about what exactly medical tourism means. It is the practice of traveling from one country to another for the purpose of treatment for whatever medical condition the patient is suffering from. Various synonyms are used for medical tourism. For example, health tourism, medical journeys, cross-border healthcare, medical value travel, etc. Some more specific terms which are used for medical tourism are surgical tourism, dental tourism, reproductive tourism, transplant tourism, etc. Medical tourism is not a new term. It dates back to thousands of years ago when Greek pilgrims traveled all over the Mediterranean to a small territory in the Saronic Gulf called Epidaura. And Epidaura became the original travel destination for medical tourism. Many spa towns and sanitariums were early forms of medical tourism. People traveled to these destinations for medical benefits. From the 18th century, many wealthy Europeans traveled across to Germany for spas and right across the Nile River. In Roman Britain, patients took a bath at a shrine, and this practice continued for around 2000 years. In the year 1326, a little village in East Belgium gained fame overnight after the discovery of iron rich hot springs. It developed into a full fledged health resort in the 16th century. India is one of the topmost favorite tourist destinations for tourism, for medical tourism, especially for Ayurveda and Panchakarma treatment. This is not only because of the availability of doctors, but it's also because of the excellent infrastructure, the affordable costs, and also many touristic places where the patients can visit. Since they are living a life full of stress. Um, Yoga in India gained popularity around 5,000 years ago. India has been visited by a constant stream of health travelers seeking to heal themselves through Ayurveda. Ayurveda has been preserved by people of India as a traditional science of life since thousands of years. 1 minute, please. Acharya Charaka discovered the treatment of many ailments through herbs and was also known as the father of Indian medicine. Acharya Sushruta was a very famous surgeon in India and Ayurveda. Ayurveda and Panchakarma treatment has been passed on through many generations from various sages. Now, I would like to explain why people opt for medical tourism. There are many benefits or advantages for the same, such as high savings, no waiting lists, high quality of treatment, world class facilities, access to the latest technology, best surgeons, customer care and comfort, travel opportunities. Since medical care is extremely expensive in foreign countries because of high taxation rates, people prefer traveling to countries such as India, where the treatment cost is very affordable. And common man can also, afford that treatment within his budget. Now, medical tourism includes the active participation of the aviation industry, travel agents, insurance and TPA companies, hospitality and hotel industry, tourism agencies, embassies and high commissions, hospitals, health spas, Ayurveda and naturopathy centers. There are other various destinations of medical tourism across the world, including Spain, Poland, Costa Rica, France, Greece, Brazil, Argentina, South Africa, Malaysia, Turkey, etc. Now, what happens in this medical tourism? The patient from various countries through video conferencing can contact the doctors in the corresponding countries where they plan to go in for treatment because of the cost, the affordable cost. Now, when they contact those doctors, generally the doctors ask them for their medical reports. So these medical reports are shared by the patients either through WhatsApp or through email. After the reports are shared by the patient with the doctor takes the medical history of the patient or the surgical history of the patient, where the doctor asks the patient about the previous treatment that he or she may have undergone, and also about any medications, whether they are on any particular medications. So once the doctor is clear about the symptoms and the reports, the doctor evaluates and assesses the reports of the patient, and then a treatment protocol is formulated by the doctor. When this treatment protocol is told to the patient, he's also given a cost estimate or a quotation. So in this cost estimate, the overall cost of expenditure of that treatment is mentioned by the doctor. So that includes also the length of stay. Now, length of stay is also a very important factor. That means the amount of time for which the patient needs to stay in that particular country, in that center. If it is an Ayurveda center, so the amount of time that the patient has been recommended by the doctor to stay in that particular center for the treatment. As per that, the patient is also guided and helped by the center with a visa invitation letter. Now, what is a visa invitation letter? It is a letter issued to that patient by the center that is on the letterhead of the center, and it includes the length of stay. It includes the number of days for which the patient has been told to stay at the center. It includes the name of the patient, the name of the attendants who will be traveling along with the patient, and for how many days the patient needs to stay at that particular center. After all that is determined, the patient takes this visa invitation letter to the embassy. For example, if the patient is traveling to India for the treatment and the doctor is an Indian doctor, so the patient needs to visit the Indian embassy in his or her particular country. And then the visa is stamped, and the patient can go ahead and buy the tickets. Or regarding the cost. And all the queries need to be resolved by the center, by the healthcare provider. Uh, Thereafter, the patient travels all the way from their country to India, for example, and then the logistic support is also to be provided to the patient. Now, logistic support means the transportation facility from the airport has to be given to the patient to come to the center. When the patient arrives at the center, the patient is given a proper accommodation. The patient has to be provided with the type of accommodation as per their preference. If they need a one room hall kitchen, or if they want a kitchen along with their room, or if they want a separate accommodation, accordingly the healthcare provider has to arrange for the same. Also, the meal, the type of meals that the patient has generally needs to be arranged by the healthcare provider. All this is taken care by the doctor or the healthcare provider or the center. Thereafter, during the entire treatment, the patient has the right to ask any queries regarding the medicines or about the treatment that he has been recommended. At the time of discharge, the patient is given a follow-up treatment medication chart, as well as follow-up time, after how many days the patient has to come again for a follow-up, and what are the medicines that the patient needs to keep taking during that time. So this is how medical tourism takes place. Now, I would like to tell something about Ayurveda. Ayurveda is considered to be the science of life and is a monumental contribution of India to the world. India is regarded as one of the most favorite destinations for people coming from all across the globe to places like Haridwar and Kerala, because these are the famous tourist destinations for medical tourism when it comes to Ayurveda. We have kept alive our ancient tradition of Ayurveda. And before the people come to India, they really don't know what they're in for. But after they come to India and they get the treatment and they find the improvement, they actually feel that they should come again and again to get the same feeling, because it's great, it's wonderful. So, Ayurvedic medicine treats through not only socioeconomic adjustment but also modification of personal habits, control of infection, pollution, etc. It involves the regulation of three doshas, Vata, Pitta, and Kapha, of the body, and involves treatment through Panchbhautik Chikitsa, the five basic elements which have been considered to be very important in the treatment aspect of Ayurveda, that is Prithvi or earth, Aap or water, Tej, fire, Vayu, air, and Akash or ether. Tourists come to Ayurvedic centers for rejuvenation as well as Ayurvedic massage. This is not simply a massage therapy, but it is a therapeutic massage therapy through medicated oils, and the treatment takes place through Ayurvedic medicines and medicated ghritam. It is a very popular form of treatment and is very effective because Ayurveda has been passed on through many generations, and is highly effective in treat. The results are very effective. Um, so 1 minute, please. 1 minute, please. Ayurveda with Panchakarma includes therapeutic massage, hot fomentation, use of purgatives or Virechan therapy, emesis or Vaman, leech therapy, cupping therapy, acupuncture, etc. And this therapy not only helps to soothe the nerves, but also improves the muscle tone and texture, relaxes the body, and reduces the stress of the person. It reduces muscle soreness and tension, and improves the overall blood circulation, energy, and alertness in a person. Now, this is what I wanted to speak about medical tourism. So I can conclude, I guess. Thank you, Miss Simran. Uh, I've completed my topic.
Yes, ma'am. Yes, ma'am. I was hearing it very carefully and very to the point. So, ma'am, what would you want to say? Would you like to say more about Ayurveda? What exactly is Ayurveda, and why people are opting for Ayurveda more these days? I have heard people
Yes.
saying कि कुछ नहीं Ayurveda से सब ठीक हो जाएगा. So why
Yes,
this
ma'am.
is so? कि Ayurveda is
Yes, yes.
booming too much.
See, what happens, ma'am, that life is full of stress and peer pressure. Children going to school are misguided by the seniors. They are forced to have cigarettes and smoking and alcohol at a very young age. Some of them are not given proper guidance. And Ayurveda is something where you have herbal cigarettes nowadays. I don't think everyone knows about this. But if you search online, you have herbal cigarettes to overcome that stress. We also have Drakshasa or Drakshovan, which we give in to substitute the alcohol, which is very healthy for the liver. It tastes and smells just like alcohol, but it is not alcohol. So that is how you can actually cheat yourself, that you pretend that you're having something, but you cheat that feeling of that urge. You can cheat it to get that satisfaction. So it is really a wonderful field. It's upcoming, and I think that people who are living a stressful life, it's very beneficial for them. It's very good for them to have a good massage. If life is stressed, then please go ahead and have a good massage. Some Virechan therapy, cleansing, detoxification, rather than succumbing to habits like smoking and alcohol. I don't think that's what life is all about. Stresses can be overcome. There are alternate ways. And not just that, Ayurveda offers you a balanced meal. The people tell you, doctors tell you about how a balanced meal can be taken. If you are diabetic, or if the patient is hypertensive, anyone is suffering from any health issues, there are ways in which problems can be solved. It is not necessary to constantly eat junk food. People are eating junk food nowadays. It's not necessary. So that's what I would like to convey, that please do not succumb to alcohol and smoking. It's not necessary to lead. Uh, I mean, it's not the way to live a healthy life. I myself, I'm a non-smoker, non-alcoholic, and I don't eat non-vegetarian either because I don't think it's healthy. I think vegetarian food has everything that you need. So I wanted to convey this message.
Rightly said, ma'am. Rightly conveyed to us. So, ma'am, I would like to say on this as well. I know that today's generation people are opting for too much of junk food and everything. I know it's
Yes,
unhealthy,
yes,
but
yes,
nowadays all the stalls and street foods are becoming like they are booming. They
yes,
are
yes.
genuinely
They
booming.
are tempting.
So
They
yes,
are
they are too
tempting.
much tempting. Yes.
I agree, it's tempting, but it's all in your willpower. You have to tell yourself that, look, I don't need these junk foods to survive. All I need to survive is a balanced meal, which may be chapati or vegetable or dal, which is homemade food. Because nowadays people are using preservatives in frozen foods. Also, there are many preservatives, and there are added, additives, and the spices that they use, they are not hygienic. They are not using them. I will give you an example. I was working for Bharatiya Vidyapeeth, which is my previous organization, and in the morning I used to take a morning walk in around the campus. So there was one dhaba. It was a stall that I used to come across, like, when the college students used to come and hang around and eat food at that stall. It was closed in the morning, and I saw a small cat getting inside the stall from the bottom. Now I thought, when that little cat goes inside, it's going to jump over all the vessels, it's going to spoil all the vessels, and God knows what it's going to do inside. So the same food will be cooked for all the people who are visiting the stall. It's not hygienic. Even the spices that they use have many additives, many preservative, wrong things added to it. It's not pure form of spices that they use. They use cheap spices, which are found at places which are not they're not advisable to eat. So they don't even clean their hands before cooking. They don't clean the vessels properly. It's not good to eat at such stalls. And the food also is kept for many days. I don't think it's advisable to eat food outside. I had got typhoid when I had pani puri at a stall in my when I was young. Since then, I've stopped eating pani puri because I don't trust those people.
I understand. I
Yes,
understand.
yes, ma'am.
Ma'am, next I am moving on. I would like to ask you what are the different Ayurvedic treatments nowadays?
What are the different Ayurvedic treatments? Okay, very good
Nowadays.
question. Yes, ma'am. Ayurvedic treatment has improvised and advanced a lot. There is Panchkarma therapy, which is excellent for treatment of any kind of disease. Like nowadays, even for paralysis or Parkinson's disease, we have Ayurvedic treatment through medication and Panchkarma. Vasti Chikitsa is one of the famous forms of Ayurvedic therapy. Vasti Chikitsa includes Niruha Vasti, Asthapan Vasti through oil usage of medicated oils and kwath, that is kada, and that nourishes the body from inside because it is given as an anima. So it cleanses the colon. It removes the internal, the things that have just cluttered inside your body, the waste material that is not been removed um, for many years, for many days. It removes that, the enema that they give. That's very healthy, I must say. And many people are going in for it. Even acupuncture has come up a lot because acupuncture relieves the stress, the body stress, and I myself have practiced acupuncture, so I will recommend it to many people who are stressed or who are suffering from some problem, health problems. Nowadays, acupuncture is available for almost any problem: headaches, migraine, asthma, arthritis, bone and joint problems, everything. So that's what.
Okay. Ma'am, does Ayurvedic medicines have side effects?
No. See, yeah, that's a good question. What I would like to say is that you need to find the right doctor, a person who is experienced for many years and who has given treatment and also got good results for many people. Such doctors would know the right amount of medicine which is to be administered to that person. Uh, Doctors who have just started their practice, they can be visited for small issues like cough, cold, stomachache. That's okay. But for big issues, you must visit an experienced doctor. Ayurvedic medicines really don't have side effects if taken in the right quantity. And if the prescription that has been given to you by the doctor is being followed in the right manner, I don't think things should go wrong.
Very well said, ma'am. Ma'am, can Ayurvedic medicine be taken along with chemotherapy?
Yes, it can be. Nowadays, we have a new therapy called immunotherapy, wherein Ayurvedic medicines are given yes, this is done to or remove or reduce the side effects of cancerous, the medications which are given, anti-cancer drugs and chemotherapy. So this immunotherapy helps to release those or reduce the side effects of those medicines. It also improves the longevity of the person, the age span, since the body's immune system, it becomes strong. It strengthens the immune system.
Ma'am, why do you think Ayurveda is important these days?
See, Ayurveda has been passed on through many centuries and many generations. But today, person has understood the importance because the allopathic medicines, they have a lot of side effects. And to tell you the truth, I'm not against any medicine. But what I observed while giving treatment and when patients came to me was that if they resolve one problem, they create 10 other problems. These are the side effects of allopathic medicines. So where some people realize that at an early stage, but some people realize at a later stage. But it's important to come at the right time to the Ayurvedic doctor because it's. I believe I have firm faith in Ayurvedic medicine. I believe in my field that medicines work. Yes, I have experienced and I have seen people recovering. So I have firm faith in my field.
Ma'am, I would like to ask you, what diseases does it help with? What diseases can be cured
All
from
types,
Ayurveda?
ma'am.
All types of diseases.
Okay, I'll name a few. I'll name a few. Problems like diabetes, hypertension, asthma, tuberculosis, arthritis, osteoarthritis, frozen shoulder, tennis elbow, any kind of musculoskeletal pain, sciatica, back pain, spine problems, everything. Like, numbness and tingling sensation that you get, radiating pain from one part of the body to the other. I have actually seen people recovering after taking Ayurvedic medicines. People have faith. Many people have faith in Ayurveda. It's unparalleled faith. Yes.
Ma'am, one personal favorite question of mine. Ma'am, I have heard about aromatherapy, right? A lot of us have heard about. So, what are the benefits of aromatherapy and what exactly is aromatherapy?
Aromatherapy, actually, I have not given to anyone. I have not given this therapy to anyone. I have also heard of aromatherapy. See, there is a therapy called Nada Chikitsa. Nada Chikitsa is treatment through music. For example, if you see on YouTube nowadays, you find music for almost any problem, for treatment of any problem. You get music for that. That relaxes your nerves, it soothes your body, and it helps you to meditate. It's very important to meditate. At least 2 to 3 hours in a day, a person should just leave thoughts of any kind of thoughts going on in the mind, and should meditate on God, or just close their eyes and meditate. It's very important, because people have they think too much nowadays, for small reasons also. They just they get stressed out very fast. So they should meditate. That's what I feel. Aromatherapy, yes, it does help you in a certain way, I guess, because there are sinuses. We do have sinuses, and I guess it relaxes those sinuses. It removes the congestion. There must be some positive benefits of aromatherapy. It's everything is connected to the brain, right? We
Right.
have cerebral, yeah, nerves. So it must be relaxing those nerves.
Ma'am, also I would like to ask you, what is self-medication? Is self-medication possible at home?
No, it's
No.
very wrong. It's the wrong thing, self-medication. Even if you know what medicine is right for you, I think it's important to consult a professional, a skilled medical professional who has a better idea about the problem. Because if you end up taking medicine which is in the wrong dosage, or the wrong strength of medication, then that can have very disastrous effects. And especially if you're young, and if you're planning a future ahead, then please do not self medicate. Please consult a professional doctor, uh, because they have better idea about what exactly you need. That's what.
So I'm moving on to the next question. What are the differences between Ayurveda and modern medicine? What are the few differences between these two?
Ma'am, there are many differences. I don't want to, I don't want to criticize any field, because allopathic has its own importance and Ayurvedic has its own importance. But people who come to Ayurvedic doctor at the right time, when their problem is aggravating, there are many problems which aggravate slowly, and people don't come at the right time because they feel it's okay. They are having allopathic medicine. They want to continue that. They don't really want to pay attention to the problem. But allopathic medicine, if I talk to you about diabetes, diabetes is a problem where people take insulin or they take metformin. Now, what is this metformin and what is this insulin? They are synthetic hormones. They are nothing but synthetic hormones. And doctors give this for a defined amount of time. But after some time, those hormones, they stop working, and the problem has many is very progressive. It can have many side effects like retinopathy, neuropathy, cardiomyopathy. There are many problems that diabetes can create, and it's disastrous. And also pus formation. uh, it can affect you to whatever extent. It can affect your eyes, skin, bone and joints. Now in Ayurveda, the medicines that we give you, it helps to, I'm sorry, it helps to slow down the progression of the problem, and and also we give you lifestyle modification, where we tell you about the kind of food that you should eat and what you should not eat. And once you follow that strictly, I'm sure that the problem can be overcome. But whereas allopathic medicine is just, they are just giving you synthetic hormones, nothing else. And also about the calcium, that I would like to say, some people are taking allopathic calcium, like Gemcal, Shellcal. These calcium products, they increase the uric acid in the body. And people suffering from arthritis, osteoporosis, osteoarthritis, they are taking these allopathic calcium tablets, which are increasing the uric acid in the body, and that worsens the problem. that makes the problem worse. The attacks of arthritis, they worsen. Whereas in Ayurvedic calcium, if you see products like Himalaya, Himalaya has a beautiful Ayurvedic calcium product called Riosto. Even Dudh Papeshwar company has a Ayurvedic calcium called Asti Poshak Vati. These do not increase the uric acid levels, and they do not even cause recurrent kidney stones. Whereas kidney stone can be caused by deposition of calcium by taking allopathic calcium, which people have experienced, and after that they have stopped taking allopathic calcium. So there were many instances where I felt that there was a difference when it comes to allopathic and Ayurveda. There are many side effects caused by allopathic medicines, but not with Ayurvedic medicines. This is a wrong notion that people have nowadays, that Ayurvedic does have a lot of side effects. No, I don't think. Ayurvedic does not have side effects. On the contrary, Ayurveda has many benefits. That's what I would like to say.
So, ma'am, moving on to the next question. Ma'am, what is the cause of health and diseases according to Ayurveda? What are the causes which are,
Faulty lifestyle, ma'am.
diseases?
Eating wrong kind of foods, cigarette smoking, alcoholism, all this has come up over the years. People have forgotten how to live. They have forgotten how to enjoy life, ma'am. If I really tell you, people have forgotten how to enjoy their life. They take stress for even small things, where problems can be solved. They are spoiling their life by taking this junk food and by smoking and alcohol. It's not required. They should enjoy life rather than making it worse for themselves and for others. I think people should really take a, like a massage would be good, a therapeutic massage would be good, or a head massage rather than smoking or cigarette smoking or something. No, I don't think it's not required. Cause is
Okay.
stress. Stress is the only cause.
Ma'am, moving on to
Yes.
the end of this session, my last question to you would be, after 12th standard, what are the courses students should opt for if they want to go ahead with the Ayurveda? And what are the what are the good traits they should have if they want to want to get into Ayurveda?
Okay. After 12th standard, ma'am, a person can opt for Sanskrit, because Sanskrit is a requirement in Ayurveda. For 2 years, they can study Sanskrit. But otherwise, diploma is also there in Ayurvedic course. But the professional degree course of Ayurveda, which is BAMS, it's the most wonderful field ever. And I also have my Sadguru with me, Sri Sri Ganapati Sachidanand Swamiji. So I worship every day of my life, and I tell my Guruji that I thank him for the field that he has given to me. I love my field. I just love my field. That's what I would like to say.
And what good traits should students have to, actually
Yes.
get into, and how much patience they should have to actually become
Yes,
an
it
Ayurvedic
requires a
doctor?
lot of patience. It requires a lot of patience. But, ma'am, I would like to say that nothing is impossible. It's not an impossible task. They can achieve what they want to. It's not an impossible task at all. Even if you don't have a Sanskrit background, you can learn Sanskrit. I had personally myself attended a lot of satsangs and of my Guruji and sang bhajans, just to get a grasp of Sanskrit and the words, to the pronunciation, and it worked a lot. It worked for me.
And ma'am, moving on to the last question, I would like to ask you, how can students make a career out of it? Career from these
Okay,
courses.
that's a very good question. See, after Ayurveda, a BAMS, one can go in for MD. And there are MD courses abroad also. After MD, you can go abroad, or you can practice in India. The salary is very good. You need not worry about that. What matters is the quality of treatment that you give to your patient. It does not matter how much you earn. It does not matter whether you're wearing excellent clothes. No, that's not what matters. What matters, if you get a degree in your hand, is whether you are giving the right treatment to your patient, whether you are listening to what the patient is talking, whether you are asking the right questions to the patient, and taking care of your patient. That is the only thing that matters. The scope is very good. You should not think that there is no scope. I'm sorry. Even in fact, I've seen many Muslims also doing Ayurveda in India. I've seen that. So I think that it's an upcoming field. It is already upcoming, and it's going to be. I think the future is in Ayurveda. The future is all in Ayurveda.
As we know that a lot of medicines are coming out of the Ayurveda.
Yes. Yes.
Lot of medicines, lot of oils,
Yes.
lot of beauty
Many,
products.
ma'am. Many. Yes, ma'am.
Beauty is also getting into the
Beauty
Ayurveda.
products, of course,
Beauty
of course,
products are
of
also
course.
getting into the Ayurveda.
Of course, yes, you do. You do.
Lot of
Very beautiful. Yes, yes. You have Kumkumadi Telam, which is very good for, as a beauty
yes,
product. Kumkumadi Telam is used for massage, the facial massage. We have Chandan, Multani Mitti. All these are beauty products, and many more. They are
yes, yes,
using many more.
yes, yes, ma'am. Moving on to the end of the session, thank you so much, ma'am, for giving
No
us
problem.
your time, your
No
valuable
problem.
time,
It was
coming
my
every
pleasure. In
session.
fact, I should thank you. I should thank you, ma'am, for inviting me, for giving me this beautiful opportunity. I was missing my college a lot. I missed my university, and today I feel proud, and I feel a lot of gratitude inside me. I want to thank you from the bottom of my heart for inviting me for the session.
Thank
Thank
you
you
so
so
much,
much.
ma'am. Thank you so
Thank you
much,
so
ma'am.
much, ma'am. Okay, bye, ma'am.